Start करो please.
कर दिया.
So today I am teaching you, or you can say advising you, the dyslipidemia. Dyslipidemia, you know, there is atherosclerosis in the arteries, in whole body and coronary arteries also, which causes or damages the heart. So atherosclerosis is initiated by subendothelial retention of atherogenic ApoB containing lipoproteins. And secondly, retained atherogenic lipoproteins induce an inflammatory process in the arterial wall. Now, the most effective therapy against atherothrombotic cardiovascular disease to date means nowadays low density lipoprotein lowering drugs. So, to remove the atherothrombotic cardiovascular disease, nowadays the LDL lowering drugs are required, which are based upon principle of decreasing circulating ApoB lipoproteins, and by LDL lowering drugs, ApoB lipoprotein will enter and retained in the subendothelium. Now, fourth point, ApoB. What is ApoB? ApoB corresponds to elevated level of LDL and non-LDL, which are occurring at early age and having low HDL means good cholesterol low, and high TG or high remnant cholesterol. Now, what is the remnant cholesterol? Also known as remnant lipoprotein, which is composed of VLDL and IDL.
LDL.
Now, you must know what is the normal remnant cholesterol. It is 15 mg per deciliter for underweight, 19 mg for normal weight, and 27 mg per deciliter for overweight. Now, the sixth point, very important, listen it carefully. According to Dr. Kenny, to reduce ApoB, which is atherogenic, consuming less dietary fat and cholesterol, and eat many more fiber-rich whole plant food, which is Preeti in eating plan. What is Preeti in eating plan? I will tell you further. It will greatly reduce the amount of chylomicrons and their atherogenic ApoB containing lipoproteins in the blood. Now, you must know the details of the Preeti in eating plan, which contains number one, fruits, vegetables, whole grain like whole wheat bread, brown rice, whole wheat pasta, and oatmeal, and starchy vegetables like potatoes, corn, and yams. Then the legumes and pulses such as beans like black bean, pinto bean, and garbanzo beans, and peas and lentils. Further, if we go, then from both international studies and national studies, following facts clearly emerge. What are those? Listen carefully. Number one, low density lipoprotein cholesterol should be the target of therapy. What is our target? Reduce the LDL. And non-HDL may be used as a co-primary target or as a secondary target after achieving LDL goal. Now, Indians have normal or high LDL, and some have associated high triglycerides and low HDL cholesterol. Now, presence of small dense LDL cholesterol, diabetes, and hypertriglyceridemia and metabolic syndrome explains such lipid patterns in Indians. Now, the third point, very important point, statins reign supremo in management of dyslipidemia. Statin is the king. Statin reigns supremo in management of dyslipidemia and high-risk SCVD subjects. Then ezetimibe is an additional IDL cholesterol lowering agent. PCSK9 inhibitors are useful only in patients who are unable to tolerate statins. Remember, if you are not tolerating statins, then use PCSK9 inhibitors, which is costly item and not available in India everywhere.